Hello and welcome to this video on sleep restriction therapy. Sleep is essential for our physical and mental well-being, and it is important to get the recommended 7 to 9 hours of sleep per night. However, many people struggle with sleep issues, which can affect their daily lives. In this video, we will be discussing sleep restriction therapy, a treatment for insomnia that has been proven to be effective. What is insomnia? Before we dive into sleep restriction therapy, it is important to understand insomnia. Insomnia is a sleep disorder that affects millions of people worldwide. It is characterized by difficulty falling or staying asleep, waking up too early, or not feeling rested enough after a night's sleep. Insomnia can be caused by various factors such as stress, anxiety, depression, medications, and medical conditions. What is sleep restriction therapy? Sleep restriction therapy is a behavioral treatment that aims to improve the quality and quantity of sleep. It is based on the premise that restricting the amount of time spent in bed will help improve the quality of sleep. The goal of sleep restriction therapy is to consolidate sleep, meaning to increase the amount of time spent asleep while in bed and decrease the time spent awake. How does sleep restriction therapy work? The first step in sleep restriction therapy is to establish a baseline of the amount of time spent sleeping each night. It is done by keeping a sleep diary for a week, recording the time you go to bed, the time you wake up, and any awakenings during the night. The average amount of time spent asleep is then calculated. The next step is to restrict the amount of time spent in bed to match the amount of time spent asleep. For example, if someone is currently spending 8 hours in bed but only sleeping for 6 hours, their time in bed will be restricted to 6 hours. This means they will need to go to bed later and wake up earlier than usual. This can be difficult at first, as the body needs to adjust to the new sleep schedule. Once the person has been able to consistently fall asleep and wake up within the restricted time in bed, the time in bed can be gradually increased by 15 to 30 minutes every few nights. This process continues until the person is able to sleep for the recommended 7 to 9 hours per night. Benefits of sleep restriction therapy. Sleep restriction therapy has been proven to be an effective treatment for insomnia. Research has shown that it can significantly improve sleep quality and reduce the time it takes to fall asleep. It has also been shown to reduce the amount of time spent awake during the night and increase the amount of time spent asleep. Additionally, sleep restriction therapy has been shown to have long-term benefits. Unlike medication, which can have negative side effects and can be habit-forming, sleep restriction therapy is a natural treatment that helps to retrain the body to sleep more efficiently. Sleep restriction therapy process. Sleep restriction therapy is typically conducted over the course of several weeks. The initial goal is to restrict the amount of time spent in bed to the average amount of time spent asleep. This can be challenging, as the person may feel sleepy during the day and have difficulty staying awake. However, the idea is to create a sleep debt that will eventually result in a more efficient and restful sleep. Once the person is able to sleep for the restricted amount of time, the time in bed can be gradually increased by 15 to 30 minutes every few nights. This allows the body to adjust to the new sleep schedule and gradually improve sleep quality and duration. Here are some tips to help make sleep restriction therapy more effective. Keep a sleep diary. Keeping a sleep diary can help identify patterns of sleep and awakenings. This can be useful in determining the average amount of time spent asleep each night. Establish a consistent sleep schedule. Going to bed and waking up at the same time every day can help regulate the body's sleep-wake cycle. Create a relaxing bedtime routine. Engaging in relaxing activities before bed, such as reading or taking a warm bath, can help prepare the body for sleep. Avoid stimulants. Stimulants such as caffeine and nicotine can interfere with sleep quality and duration. It is best to avoid these substances in the hours leading up to bedtime. Limit screen time. The blue light emitted by electronic devices can interfere with the body's production of the sleep hormone melatonin. It is best to limit screen time in the hours leading up to bedtime. Who is a good candidate for sleep restriction therapy? Sleep restriction therapy can be a good treatment option for individuals who have chronic insomnia or difficulty falling or staying asleep. However, it may not be appropriate for everyone, and it is important to speak with a healthcare professional to determine if sleep restriction therapy is a good fit for you. People who have certain medical conditions or who are taking certain medications may not be good candidates for this therapy. Is sleep restriction therapy effective for everyone? While sleep restriction therapy has been shown to be effective for many people with insomnia, it may not be effective for everyone. Some individuals may require a combination of therapies or a different treatment approach. It is important to work closely with a healthcare provider to determine the most appropriate treatment plan. Can sleep restriction therapy be done at home? Sleep restriction therapy can be done at home, but it is important to work closely with a healthcare provider to determine the most appropriate sleep schedule and to monitor progress. It may also be helpful to work with a sleep specialist or therapist who can provide guidance and support throughout the process. Are there any risks associated with sleep restriction therapy? While sleep restriction therapy is generally considered safe, some individuals may experience temporary side effects, such as fatigue or irritability as the body adjusts to the new sleep schedule. Additionally, it is important to work closely with a healthcare provider to ensure that sleep restriction therapy is appropriate for your specific health needs. How long does sleep restriction therapy take to work? Sleep restriction therapy can take several weeks to work as the body needs time to adjust to the new sleep schedule. It is important to be patient and consistent with the therapy, even if improvements are not immediate. Over time, the body will become more efficient at sleeping, resulting in better sleep quality and duration. What are the benefits of sleep restriction therapy? Sleep restriction therapy has been shown to have a number of benefits, including improved sleep quality. By consolidating sleep, sleep restriction therapy can improve the overall quality of sleep, resulting in a more restful and rejuvenating night's sleep. Reduced time awake during the night. By limiting the amount of time spent in bed, sleep restriction therapy can reduce the amount of time spent awake during the night, resulting in a more restful sleep. Increased daytime energy and alertness. By improving the quality and duration of sleep, sleep restriction therapy can result in increased daytime energy and alertness, allowing individuals to be more productive and engaged throughout the day. Natural and non-invasive treatment. Unlike medication, which can have negative side effects and can be habit-forming, sleep restriction therapy is a natural and non-invasive treatment option that helps to retrain the body to sleep more efficiently. What are the risks of sleep restriction therapy? While sleep restriction therapy is generally considered safe, some individuals may experience temporary side effects such as fatigue or irritability as the body adjusts to the new sleep schedule. Additionally, it is important to work closely with a healthcare provider to ensure that sleep restriction therapy is appropriate for your specific health needs. How does sleep restriction therapy compare to other treatments for insomnia? Sleep restriction therapy is a behavioral treatment that has been shown to be effective for improving sleep quality and duration in people with insomnia. Other treatment options for insomnia include medication, cognitive behavioral therapy or CBT in short, relaxation techniques, and sleep hygiene education. Medications for insomnia can be effective in the short term, but can also have negative side effects and can be habit-forming. CBT is a type of talk therapy that can help individuals identify and change negative thoughts and behaviors that may be contributing to their insomnia. Relaxing techniques such as meditation and yoga can help reduce stress and promote relaxation. Sleep hygiene education involves adopting healthy sleep habits, such as limiting screen time before bed, avoiding caffeine and alcohol, and creating a comfortable sleep environment. Each of these treatments has its own benefits and limitations, and the most appropriate treatment plan will depend on the individual's specific needs and preferences. Are there any alternative treatments for insomnia? In addition to sleep restriction therapy and other traditional treatments for insomnia, there are also some alternative treatments that may be helpful for improving sleep. These include acupuncture. Acupuncture involves the insertion of thin needles into specific points on the body to promote relaxation and reduce stress. Herbal remedies. Some herbal remedies, such as chamomile tea and valerian root, has been shown to have a calming effect and may be helpful for improving sleep. Massage therapy. Massage therapy can help promote relaxation and reduce stress, which may be helpful for improving sleep. Light therapy. Light therapy involves exposure to bright light in the morning or evening, which can help regulate the body's sleep-wake cycle. It is important to talk to a healthcare provider before trying any alternative treatments for insomnia. Conclusion. Sleep restriction therapy is a behavioral treatment that can help improve sleep quality and duration in people with insomnia. It involves restricting the amount of time spent in bed to the average amount of time spent asleep, and gradually increasing the time in bed as the body adjusts to the new sleep schedule. Sleep restriction therapy is a natural and effective treatment option that can have long-term benefits. If you are experiencing sleep issues, talk to your healthcare provider to see if sleep restriction therapy can be a good treatment option for you. Thank you for watching. If you're interested in discovering more about therapies and psychology, then be sure to check out this video at the first link in the description. Subscribe and turn on notifications so you don't miss more videos helping you with therapies and more. Check out this playlist of my top 10 videos, and I'll see you in the next video. Take care.